In the Pavlovian conditioning, there is 3 stages. In the first stage, prior to conditioning, there is unconditioned stimulus, which produces an unconditioned response, meaning that the stimulus produces a natural response. There is also a neutral stimulus, which does not produce any response until it is paired with the unconditioned stimulus. In the second stage, during conditioning, the neutral stimulus becomes known as the conditioned stimulus. The unconditioned stimulus is now associated with the conditioned stimulus. In stage 3, after conditioning, the conditioned stimulus that is associated with the unconditioned stimulus produces a conditioned response. Furthermore, Pavlovian conditioning can contribute to tolerance.
In the study, 76 heroin addicts were admitted to an emergency room in the university hospital we used in the study conducted by Gutierrez and Gewalada. 54 subjects were admitted because of heroin overdose, and 22 of the subjects were admitted because they were seeking urgent medical care for unrelated conditions. The patients who were recently used heroin and who did not suffer an overdose all had injected in an environment where they had previously used drugs before. In contrast, 100% of the patients that injected in an unusual place and did not overdose, only 48% of the overdose patients injected in an unusual environment, and 52 injected in an unusual setting.
In this study, Siegel hypothesizes that most drug-related deaths are not due to pharmacological overdose, but rather because their drug tolerance is lower when it is not paired with its usual paired cues. Overdose victims typically have a long history of drug use. Therefore, they build a higher tolerance for the drug. Previous studies, however, have found that about 3/4 of the victims of heroin overdose have blood levels of morphine no higher than those seen in a control group of heroin addicts who had died as a result of homicide. One must conclude that in the majority of cases, death was not a result of toxic quantity of morphine in the blood.
There are many factors that contribute to heroin overdose, such as too much of the drug in the body, as well as a synergism between the opiate and other drugs at the same time. However, some overdoses occur because the opiate addict, who can usually tolerate extraordinarily high doses, is not tolerant at the occasion of the overdose due to being in a different environment. There are considerable data in experiments and with overdose victims that support this interpretation of some heroin overdose.